All right, welcome back. We carry on with our discussion briefly. Drug abuse crisis. Children as young as 6 trying drugs is what a new government survey revealed. And Honorable Passaris, I want to get some thoughts from you. You have some thoughts about the state of a nation, the challenges of the economy and how that contributes to the, what we're seeing, but also what are your ideas in terms of solutions? What more can Parliament do, for example, to fight for children?
Okay, you see, look, I feel that when we try and pretend to be so religious, I wouldn't call it spiritual, we're always putting the religious card that, oh, we're Catholic, our values, our, this is not our culture. We have this tendency of pretending that we are so holy. The Bible came from the West. The West are taking certain decisions because they've realized that an economy cannot be, an economy requires to be contained. In the 60s, and I say this all the time, in the 60s when Tom Mboya was interviewed after Kenya was gained independence, and he was asked, what is your view about Kenya? What is your plans for the country? He said family planning. Why? Because we have limited resources. But when we start talking family planning, here is the church coming out and saying, no, we cannot. Let me tell you, God gave us wisdom. Wisdom dictates that you cannot just bring children to bring children. Just because you're getting intimate, you have children. At the end of the day, you have to have children because you've planned. You have to have children because you can afford to have the children. All right. You have women that are unemployed, single mothers that have 4 children. All right, and they can't afford even to feed themselves. Then you have your children on the streets. A child on the street being sodomized, being raped, being put on glue, and we don't have enough programs to absorb them. So what are the solutions? So the solution is we need to talk family planning as a country. You've got a huge population of youth that have no jobs. We need to start talking family planning. We need to start educating people on the need to have planned families. We need to make sure commodities are available so that when people are engaging in sexual activity, they don't just have children and then you go for abortion. The ripple effects is too much because then you have abortion, then you have post-abortion care, then you have deaths. So for me, I think as a country, we need to actually start addressing the issue from where the problem starts. That is population control. Then we have to also make sure we deal with corruption so that our resources are actually put in to assist the greater masses, the majority of the people. We need education. We've got free primary education, free secondary education. What about the quality of education? Because you come out of school and you can't read or write or do maths, then what's the point? All right? Or you come out of school or you've come out of university and you can't get a job. You see, this is what leads to depression. This is what leads to crime. This is what leads to drug consumption. So as a nation, we've got to have a holistic approach. How you live and where you live. Don't think that the person who lives in the slum with the sewer right out there is not feeling depressed about it. That my children are playing in this. My children got cholera because the water they drink is not safe. Or my children didn't sleep last night because it rained and the neighbor's house was washed away and her classmate was washed away and died. So they're scared to sleep because there's rain in the slum. So these issues are what we need to address. And slum upgrade, the agenda of the government is good. Housing, it's important. But we need a holistic approach. Okay. If we're going to build the houses, let's create the jobs relevant to the housing. Okay. If we're going to have manufacturing, let's create the jobs. I think the government has a good agenda, and that's why it's important that we stop politicking and actually start thinking people and start working for the people. Martin, even as you come in, when you look at our legal framework and how it protects children, how it punishes drug traffickers, etc. Are there any concerns you have? Is there any way in which you feel that could be one part of fighting this problem?
One, it is not just the legal system, but it's also the public health system. I think when you come drugs in the public and to which then minors have access to me it is a public health issue. So we look at it from the regulatory framework. How do we enforce the law so that one, we keep drugs away from access by children, but two, how is our public health system organized? So that we cannot leave public responsibility to private individuals, because it gets to a point, for example, in the circumstances where the best quality of care at family level is not available, then the state sets in. What are the responsibilities of the state? So we must ask ourselves as we look at this, what are the relevant state organs doing? What is the public health system doing to ensure that all the necessary apparatus are put in place to ensure that we have an environment that is facilitative of the best development of children. So we need to, yes, enforce our laws, but also make those laws progressive, so that they are facilitative of the environment we are looking for. So for me, we need to the problem should be placed where it lies, and responsibility and accountability must be asked of the responsible public institutions that deliver public health, but also enforce the law, because there is a framework. Before we even say it is wanting, let us fully enforce it, both from the public health perspective, but also from the administration of justice perspective. Let us enforce the law. Let us take drugs away from reach of children, and where we think there are deficiencies in family setups or just in parenting, there should be mechanisms also of dealing with that.
Right. Teresa Omondi, I would love to hear your ideas on solutions, but from a societal point of view. You know, you had earlier teased the fact that, you know, your parent will give you, you know, a snip of whatever whiskey they're drinking. So it starts at home.
Yes, it starts at home.
And by the time your child is hitting 16, they're also drinking, and you're wondering why. But you gave them a taste when they were 5 years old.
You forgot you started. But I know there are parents who'd also argue, because I know of parents who argue, I'd better be the first one to show you or teach you. But I think also it would be nice if you could also go all the way and just confirm that throughout until when maybe they are 18 and very responsible, or 21, it depends what age you find your baby is now mature to go on, that you monitor that. And it takes me back also to where I started. Like, if we can have parents who are both responsible. When I said there are women who are looking for where the fathers of their children are, or asking the fathers of their children to support them, I'm not only putting the blame on fathers, but I'm saying, is it time, whatever differences we have, and this is one of the things we try to champion now on mediation, can we just agree to disagree that we can raise these children in the right way and keep them where they need to be? At 9, they need to be in a school, and they need to be playing in a playground, and they need to be going for enjoyable recreational activities, so that their minds are not distracted to drugs. That's one of the things. I'm not saying it's 100% solution, but from how we raise them, then it will determine their end results. But there's also one thing I wanted to say, that then if you find like one of the things I was reading in one of these WhatsApp messages, where someone said, don't just ask your child how was school, and then they go like, fine, and then that's it. And that's start by right. So in the morning, and then what did teacher say, and then what did you do, and then after that, somewhere in between, you start noticing whether there's a section of the day that doesn't make sense.
And that's the thing, Teresa. Our Kenyan families, within our own household, at the basic level, are we having this conversation with our children? Are we talking to them about alcohol, be it at 6 or at 10 years old? Within those levels, by the time they get to 18, are we having these conversations about alcohol, reproductive health? In America, they're told, parents, especially coming from black communities, sit down with their children and tell them, listen, you're black and you're living in America. I send you to go buy bread. I may never have you back here at home. So if a white cop stops you, this is how to react. They're having those conversations with their sons and daughters, whether they want to or not. But coming back here in Kenya, are we doing the same thing at the basic level, at our family basic unit? Are we having those conversations with our children?
Okay, we are not, for one reason. Okay, not everybody, but majority of us are not, for one reason that already Honorable Passari said. There are certain religious factors that make us think it is wrong to start speaking about these things. And by the way, as I say, parents who give you a taste of the alcohol, I'll go back and say that if you are ready to journey with them to the end, then that makes a lot of sense, because then it means I want to know how much you can. And we've even had a colleague, I think sometime back when I was here on the show, same issue on the drugs, where, and he said, I had to go with him and see how much glasses he can take, you know, of the alcohol, something like that. If we are taking that control and speaking openly about it, then it would happen. It goes back to also things on first attempt to your sexual debut, reproductive health rights issues, talking even about, yes, guns and police officers and all that. Let's be able to openly speak about it without hiding behind the issues of, oh, you know, religion, this is not something I can expose, you're not yet ready for it, because someone else then will teach your child on your behalf.
Okay,
yes.
okay.